Hey, good evening, everybody. My name is Dr. Nathan Thompson with Exemplify Health Center, an affiliate of the Wellness Way right here in Yorkville, Illinois. Happy Monday evening, guys. Thank you so much for joining me. I always get a kick out of people who actually want to hear what I want to say. So if you're joining me right now, thank you very much. I appreciate you guys spending some time with me. And if you are watching, just make sure that you please, as always, say hello. Let me know where you're watching from as well. We have people who watch from all over the world: Canada, United States, New Zealand, Australia, Thailand, Europe, you name it. People watch it from all over, and I think that is really awesome. And I am grateful and also humbled when people want to hear me speak. So I'm going to go over with you guys maybe kind of a specialty topic that may not actually involve specifically you, and if it does, make sure that you listen all the way through. But I'm going to tell you something. You probably know somebody who experiences gout, and I'll explain to you what that is, but I'm also going to talk about it's not about food avoidance, because if someone does have an episode of gout, it really is signifying there's some deeper problems that are going on. And usually the lifelong thing that people do is they're going to avoid foods high in purines and then go on some medication that is going to manipulate the body when it comes to uric acid levels in the body. I'm going to talk to you something really, really interesting, guys. And this, as I was going through this and I was preparing, I had an aha moment. I'm like, oh my goodness, how many people could we get out of the medical merry-go-round when it comes to gout? However, it's going to have to take some initiative from the person themselves in order to change their lives. And in fact, guys, just today when I was in consultations, had a wonderful woman who's been working with me for 2 years, looked at her blood work, absolutely perfect immune numbers, inflammatory levels, like you name it, was just absolutely awesome. And it wasn't that way 2 years ago, but she's done an absolutely awesome job as far as food allergies, as far as her sugar intake, as far as healing her liver, GI system. And at one point she had 36 food allergies. We just retested, it's down to 9, and inflammatory levels like CRP went from almost 7 down to 0.4. But it took time in order for her body to repair and to heal. And it took a lot of effort on her part. And I always say it's if it was easy, everybody would be doing it. And so this is why our care is not for, I'm going to say, the typical person who wants a supplement or who wants a quick fix. That's what you have the medical system for, and I'll go over that too at the end. And so, guys, if you were at the immune system talk, for those people that were there for that in-person event, guys, thank you so much for being there. Hopefully you guys learned a lot. The biggest feedback that we get is that people say you explained the immune system and finally made me understand how it works and how the body is actually set up to be able to fight off foreign invaders or any kind of foreign protein inside of the body. And it actually helps you understand why in medicine, when it comes to viral and bacterial quote-unquote prevention, why they do it backwards. And it's one of the reasons why, in my opinion, why there is today so many issues with toxicity, with developmental neurological disorders, on the spectrum all the way up from ADHD down to autism, and also with autoimmunity as well. So if you guys were at that event, thank you so much for being there. We also have a pretty awesome announcement that we're going to be telling you guys about in just a second about the Make Immune Systems Strong Again event. Before I do that, I was with a new patient today, and she had said, this is my Willard Scott moment. If you guys don't know who this is, remember Willard Scott back on the Today Show would do, I think, 100-year-old birthdays or something like that. But I'm actually going to give a shout out to someone who's not a patient, but it's he is a woman's wife or husband that I saw earlier today. She says, I really want to do this journey with my husband. And I want to be able to do this together, and I know that he has some issues that are going on, and I really want to just get healthy together. I will tell you guys something. The people who get the best clinical results are actually when a husband and wife does it together, because you have that level of accountability. So I want to give a shout out to Larry from Ottawa, Illinois. Larry, I hope you are watching this, And I hope you learn lots, and I hope to see you very soon in the office, all right? So guys, just before we go into this, remember our next in-person event is going to be our inflammation event. Guys, there's so many people who just have no idea where to start. I said you have to start with inflammation. I want you to think of the scab. If you keep falling on your knee and keep breaking the skin and keep causing and keep injuring that scab, I don't care how many supplements you're on to help that skin to heal, it's never going to heal unless you first stop falling on your knee because you keep inflaming it. So guys, things will not heal if you keep irritating it, and that has to do with inflammation, has to do with the immune system. So coming up, I think that's October 18th. At 6:15 p.m. here at Exemplify Health Center. All you have to do is go to the top of the page. You'll see a post that is pinned to the top of the page in regards to the inflammation event. Go ahead and click on that link, and then you can register for that in-person event. And a lot of times when people ask me whether they want to become new patients, no matter what they have, I say come to the inflammation event. It will be worth your while, and it will also help you to understand where you need to start. Guys, we're all in the business of actually helping a person eventually get to the point where they can take great care of themselves. I think that's what the purpose of a doctor is. Doctor equals teacher. And so we're teaching people how to take charge of their health. And I tell people, I said, I'd be happy to take care of you, but if we're still having the same conversation a year from now, then you have permission to fire me, and I also have permission to fire you. And the reason why is that we need to help the next person. And so that's why understanding where to start and getting you started on your journey is a great place so that you can start taking control of your health rather than leaving it up to a doctor who is going to lead you down a path of just putting out fires and never rebuilding the body. It's called the fireman-carpenter principle. So guys, go ahead and make sure you get registered for that if you are in the Chicagoland area. And number two, super important announcement, guys, because people have been begging for this, and I'm going to say, all right, well, we'll go ahead and we'll get this set up. We will have a minimum that we have to meet for this webinar, only because, when I do it, it will take up, probably 2 hours, 2.5 hours of my time, and then setting everything up and, everything else. So I'm going to assume that if you wanted it, like you said you did, then you are willing to register for it and show up to this event. Guys, we are going to be doing a webinar version so that this can go literally anywhere in the world. So it can get up to Canada, it can be here in the continental United States, in Europe, doesn't matter where you're from, that you can register for this webinar. And it's basically almost the exact same talk that I did last Saturday. So what I taught on Saturday, we'll teach in this webinar version of it as well. Guys, it is unbelievable because we're going to show you how the immune system works. We're going to show you, based on physiology, how the immune system works, and actually why people are so sick, because how we're handling the immune system is completely backwards. And then we also have some updated information in regards to COVID-19 and the boosters, why they've been an absolute abject failure. But the only reason why we have to do it on a webinar platform, because I guarantee you Facebook would shut this down. YouTube would not allow this as well. But a webinar platform, they will allow this, all right? So I guarantee you this will get shut down within 10 or 15 minutes of doing this, or get taken down if this was on Facebook. So we have to go kind of off the platform in a webinar version. So make sure, guys, you can also click the link in the description of this video or go to the top of the page and register for it. You'll register via Eventbrite. Tickets for it are $20 in order to help pay for the webinar software. And then what we will be doing, guys, is we will be emailing you 1 hour before the event the link to directly join the room. So that way you don't have to actually register for the webinar. Just get the link. It will take you directly into the webinar room. And we will be going from 10 o'clock to 2 o'clock, or 10 o'clock to noon on Saturday, October 21st. The good thing is that if for some reason you can't make it, still register for the webinar, because the replay of it will be available, I believe, for 48 hours afterwards. So guys, right now make sure, or right when I finish up, make sure that you get registered for that event. And this can be, you can join from anywhere in the United States, Canada, or anywhere. Excuse me, that's the beautiful thing about technology. So get registered for it, please. Right now, and I will actually be doing that webinar live, okay? So let's talk a little bit about gout and why it's not just by avoiding certain foods, okay? And I'm going to give you an example, because this is certainly true with not just when someone has gout, but it's whenever anyone ever has an injury. Remember, gout is an injury. Type 2 diabetes is an injury. There's many heart disease is an injury. The reason why I say that is that an injury means you can heal from it. An injury means it is something that I have done to injure something, versus an illness in which there's no hope and there's no cure. So one of the things that happens, excuse me, when we have an injury is we immediately devolve ourselves into protection mode. And when we devolve into protection mode, we now need a lifetime of supports, of braces, and just trying to do whatever we can in order to make it easy. Excuse me. So I want you to think about, I have a back injury. Now I need to wear a back brace for the rest of your life. Now I have a wrist injury. I have carpal tunnel syndrome. I need to wear a wrist brace for the rest of my life. I have tennis elbow. I need to wear a CHO pad on my elbow for the rest of my life. I have, bad feet. I need to be in orthotics for the rest of your life. And guys, yes, some people do need to be in orthotics, but I say we'll put you in those while you start to rebuild and start to reconstruct your feet. So, we even go so far as, I have bad feet, and so I'm going to wear the most cushiony, the most arch support footwear, and I'm like, that's one of the reasons what got you there. That level of mentality got you being sick, injured, and deconditioned, because you had an injury and you babied it, and now you are even more deconditioned, and you're even worse for the wear as a result. And so you think about it, rather than actually rise up and fix the reason why it's happening in the first place, we just devolve into braces, we devolve into canes, we devolve into walkers, rather than figure it out and say, you know what, I'm not going to take this as an answer, and I'm going to start working on making myself better. And I'm going to express as much potential as possible according to where I'm at with my age. But guys, what is so amazing is that so many things that we attribute to age is actually should be attributed to injury accumulation over time. That's why people say you should take it easy. You shouldn't work out that much. You're 45 years of age. And I said, I'm going to work out as long as I want, and I'm going to not enjoy my youth. I'm going to work on preserving my youth. So why am I talking about this when it comes to gout? Okay, it comes down to this. Someone gets gout, or any other health condition for that matter, and all they do is say, Doc, give me the meds. Just give me the meds. And what do I need to do? Oh, I need to avoid certain foods. Got it. Well, I'll try not to, but as long as you give me enough meds, I think I should be okay. But the reality is whether it's an injury, whether it's a chemical injury, or whether it's a physical injury, whatever it might be, you have the choice. You have the choice to adapt or devolve. Two choices. That's it. So if someone has an injury, they have the choice to brace it up, weaken it up, and baby it as much as possible. Or if you have a chemical injury, drug it up, numb it up, just avoid certain foods. And we call that either adapting or devolving. What do most people choose? They choose to devolve, okay? They choose to get weaker. And the only reason why, guys, people don't go on a healing journey, or they don't work on healing themselves, is for only two reasons. They didn't realize they could, or they just don't want to. And that's the only two reasons. They didn't realize they could, or they just don't want to. And the first step is they have to realize that they can. Then the next step is they have to say, well, I'm going to count the cost because this is going to be a lot of work. Maybe I'll just go back to my comfort zone. Maybe I'll crawl back to my security blanket. Maybe I'll just go and be safe rather than actually start to adapt as well. Because doing this is easy, requires no effort. This right here is hard, and it requires effort. So adapt or devolve, guys, you have two choices. You can weaken the environment to suit a weakened body, which is actually what medicine does, actually when it comes to meds and vaccines and things like that. Or you have the choice to strengthen the body to withstand the environment. That's what we always try to do, is let's strengthen the body to withstand the environment. Same thing can be said when it comes to a person's immune system. We saw it over the last 2.5 years. Rather than say, let's take the weak and make them strong again, they said it doesn't matter, let's weaken the environment to suit the weakest. And that was called compassion for some reason, but that was actually, should have been called enabling. See, if you have the child who is, the rebel teenager, too many parents, they actually enable them to continue with their bad behavior versus actually strengthening them and actually using something that's known as discipline in order to help grow them into a stronger human being. So you have the choice, guys, to adapt or to devolve. So when it comes to gout, guys, let's go to one of the, considered the best in medicine, the Mayo Clinic. Excuse me. And in fact, where I am from in this area, if someone is unhappy with their diagnosis or unhappy with the doctor's treatment plan, then they're going to get those answers at the Mayo Clinic. And I always kind of laugh because I say, well, Mayo Clinic, they may figure out what's wrong with you, but they're still going to recommend the same treatment. See, too many people, they find so much comfort in their diagnosis, and they actually don't find the comfort in the actual cause or the cure. Okay, so let's go to Mayo Clinic. Mayo Clinic describes gout and describes the symptoms. The symptoms and signs of gout almost always occur suddenly and often at night. Huh, that's interesting. Why at night? Because at night, your cortisol levels go down and your melatonin levels go up. When cortisol goes down, the immune system's actually going to pick up, and that's why it happens at night. That's also why when people say, oh my gosh, I woke up so stiff in the morning and it must be my bed, I said, before you change your bed, change your lifestyle, because one of the reasons why you get sore in the morning is because you're going to bed so inflamed and the body is working on repairing and healing, and inflammation is actually the process of healing and repairing. So here's the sum of the symptoms. Intense joint pain. Gout usually affects the big toe, but it can occur in any joint. The pain is most likely to be the most severe within the first 4 to 12 hours after it begins. So why does it usually take place in through the big toe? Well, that's because uric acid actually will, as it moves away from the core and goes into the extremities, the blood will get a little bit cooler, and so those uric acid crystals will then start to suspend and settle in within the joints. Why is it the most discomfort for 4 to 12 hours? Well, look at it as an acute injury. Anytime you have any kind of ankle sprain, back issue, or whatever it might be, it's always going to be the most painful in the first 4 to 12 hours, because that pain is actually one of the cardinal signs of acute inflammation. You also can have lingering discomfort. After the most severe pain subsides, some joint discomfort may last from a few days to a few weeks. Why is that? Because when you look at complete resolution of an inflammatory process, it usually takes 3 days to 14 days. And who says so? Medical physiology. Okay? It causes inflammation and redness. The affected joint or joints become swollen, tender, warm, and red. That means that it is inflamed. So when we say inflammation, especially acute inflammation, is that it gets red, it gets painful, it gets swollen, it gets warm. Those are the signs of acute inflammation. So all that they're describing is saying when you have gout, it gets really inflamed and it ends up usually in the big toe, because it is one of the coolest area of the body for those crystals to actually start settling in within the joint. Now, Mayo Clinic talks about some causes as well. So, gout occurs when urate crystals accumulate in your joint, causing the inflammation and intense pain of a gout attack. Urate crystals can form when you have high levels of uric acid in the blood. Your body produces uric acid when it breaks down purine, substances that are found naturally in the body. So purines are actually a product of metabolites in the body, but you also get some of them from your food, but they tend to blame food all the time. So purines are found in certain foods, including red meat and organ meats, such as liver. Seafood includes anchovies, sardines, mussel, scallops, trout, and tuna. Alcoholic beverages, especially beer, and drinks sweetened with fruit sugar or fructose promote higher levels of uric acid. Now, what they're saying is that if you have an episode of gout, you should avoid the foods that are high in purines, which means that you should not have red meat or you should not have organ meats. Now, let me ask you something. What is the highest food that is highest in nutritional content and density, especially when you're talking about minerals and vitamins? It's actually liver, okay? So the very thing is it's one of the best foods in the world are going to be organ meats. Now, what they also say is when uric acid dissolves in your blood and passes through your kidneys into your urine, but sometimes either your body produces too much uric acid or your kidneys excrete too little. And when this happens, uric acid can build up, forming sharp needle-like crystals in a joint or surrounding tissue that cause pain, inflammation, and swelling. See, here's where Mayo Clinic even gets it wrong. Because what they're saying is that your body makes too much uric acid, meaning that your body messes up. And if you come from the perspective that the body doesn't mess up, that the body does not make mistakes, then you're going to understand that the body doesn't make too much uric acid, that the immune system doesn't attack itself, and that everything in that high blood pressure is necessarily all bad, and all of that is an adaptation. It's how your body is adapting for survival. Or your kidneys excrete too little uric acid, and I'm going to talk about that in a second, and that the only way it can excrete enough uric acid is if you actually have kidney inflammation. But if you have kidney inflammation, probably you're also going to have liver inflammation as well as a lot of GI inflammation too. And it's actually creating more of a demand on the kidneys that they cannot handle. So even Mayo Clinic, they're saying things like the body is always messing up. And if you come from that perspective, then all you can do if the body messes up is manipulate the body to what you think the body is supposed to do. And we have seen that there are devastating consequences when we think that man can outsmart the wisdom of the body. So Mayo Clinic says, here are your risk factors, okay? Is they say diet. So diet is a risk factor. Eating a diet rich in red meat and shellfish and drinking beverages sweetened with fruit sugar like fructose, I agree with that as far as fructose is concerned, increased levels of uric acid, which increase your risk of gout. Alcohol consumption, especially of beer, also increases the risk of gout. I'm going to tell you something, is that the biggest reason why this will increase gout is because fructose and alcohol consumption is extremely hard on the liver, and I'll show you why that can cause gout in just a second. Now, another one they say is weight. If you're overweight, your body produces more uric acid, and your kidneys have a more difficult time eliminating uric acid. I love how people just blame being overweight or obese as if just the fact that you're overweight is a risk factor. And I will always say this, and I would say, yeah, if you accumulate a certain level of body fat, that can actually accentuate inflammation. But what's more important than having excess body fat is actually what you did in order to cause the excess body fat. That's what's more important than just carrying around some extra weight. Certain medical conditions like untreated high blood pressure, chronic conditions such as diabetes, obesity, metabolic syndrome, and heart and kidney diseases. What are causing this? Inflammation. Let me say that again. it's not that these medical conditions happen for no reason, they're happening because of inflammation. Certain medications, like taking low-dose aspirin, and some medications used to control hypertension, including diuretics, including ACE inhibitors, beta blockers, can also increase uric acid levels. So can the use of anti-rejection drugs prescribed for people who have undergone an organ transplant. So I find it interesting is that even one of the causes is actually blood pressure medication. So they're saying if you have untreated high blood pressure, that can cause gout. Mayo Clinic also says if you're taking a blood pressure medication, that can also cause gout. And the reason why is it's not getting to the cause. If you have a family history of gout, I would challenge that as well, because it is not genetic. You just picked up your parents' bad habits and started living that way as well. Also, age and sex. Gout occurs more often in men, primarily because women tend to have lower uric acid levels. After menopause, however, women's uric acid levels approach those of men. Maybe there is something protective when it comes to your estrogens. Recent surgery or trauma. So recent surgery or trauma can sometimes trigger a gout attack, and in some people, receiving a vaccination can trigger a gout flare. That's interesting. Is it the vaccination, or is it what the vaccination does to the liver and to the gastrointestinal system? Food for thought, okay? Now, I want to show you, this is kind of a complex graph, but I want to show you why it's not just because you're eating too many foods. I'll show you, all you have to do is look at what is known as purine metabolism, okay? Now, purines are actually the reason why they're higher in things like muscle meat and liver is because purines actually are the amino acids that make up your DNA. And so look at the things that make up actually DNA. These are considered purines, which is why you're going to see it higher in muscle meat and also in liver, because the amount of cells and DNA that are actually in there. And so when you look at this, how purines are actually metabolized, guys, they're actually metabolized in the liver, okay? So you actually will have 2/3 from just how you're metabolizing things in your body and only 1/3 from foods. So when a doctor says you need to avoid these foods, all they're saying is they're only fixing 1/3 of the potential cause, but it's really not the foods that are contributing to it. It's actually the problem with your liver and also with your gastrointestinal system, and it can also be a problem with your kidneys. So only 1/3 is actually coming from dietary purines, in which those are absorbed and then metabolized within the liver, and the liver then produces what is known as uric acid, okay? So uric acid is released into the blood or from the liver, and then it can actually be metabolized back into the gut through the bile, through the gallbladder, and then also it can be excreted through the kidneys as well. So it can either be excreted in the gastrointestinal system or through the kidneys. But think of this, guys, liver. Anytime that the body is detoxing, primary removal is coming from the gastrointestinal system and also through the kidneys, but it has to be metabolized from the liver first. So what's interesting is that 10% in the urine, of that 10%, 90% is reabsorbed by the kidneys, which actually means that most of it is getting excreted into the gastrointestinal system. Pay attention to that, okay? So really when you look at it, you have to consider everything as a Swiss watch. You have to consider the liver, you have to consider the gastrointestinal system, you have to consider the kidneys. And there are chronic inflammatory conditions that will affect all three of those. But guys, it will take me back to this, is that the people who are having gout are the people with liver inflammation, known as fatty liver, non-alcoholic fatty liver disease, or fatty liver disease from alcohol. So when you blame the alcohol, really what you should be blaming is what the alcohol and what the fructose is doing to the liver. And the reason why you might get a little bit better when you avoid alcohol is because you're taking some stress off of the liver. The reason why if you avoid certain like fruit juices, because you're taking some stress off of the liver. But there was a really interesting article in Frontiers in Immunology, February 2022, so just about 8 months ago, and they said this: the role of the intestine in the development of hyperuricemia, otherwise known as leading to gout. Okay, so here's what they say. Current studies have shown that the intestine is an important potential organ for the excretion of uric acid outside of the kidneys. The excretion of uric acid of the gut is mainly achieved through the action of uric acid transporters and the catabolism of uric acid by intestinal flora, which plays an important role in the body's uric acid balance. Interesting, huh? Because now they're talking about, well, it's not just a kidney issue. This also can be an issue in the gastrointestinal system because there's an issue in your own microbiome. You remember all those cells, 100 trillion of them, that live in the colon, that are there to actually help you and not hurt you? You can have it overgrow, you can have it crawl into the small intestines, you can have excessive yeast, and it's not that you caught it, it's that the environment is actually causing certain things that don't belong there to grow because that's the environment that it actually is preferred. You have a bad lifestyle, you will have a bad microbiome. Why? Because what you eat, how you digest your food, your stomach acid, your digestive enzymes, the bile, all of those things will either cause a good environment or a bad environment that will cause other things to start to grow. But they said what's interesting is the microbiome, okay? So in the article, it said the influence of intestinal flora on uric acid and gout. They said at least 100 trillion bacteria in the intestinal micro ecosystem live in the human intestines. 100. That's 100 trillion is more than the cells that comprise who we are. They estimate that we're about 75 trillion, yet you literally have an alien of 100 trillion bacteria already living inside of you. Now, they participate in metabolism, immune regulation, and maintenance of internal environment homeostasis. Increasing evidence showed that there are differences in the distribution of intestinal flora between gout patients and healthy people. Studies found that supplementing probiotics can improve uric acid levels. Now, everyone now is on Amazon trying to find a probiotic. How do you know what type of probiotic you should be taking? Get a stool test. So here's what they say. So it's been shown that intestinal bacteria can decompose uric acid. It can decompose it. Under the action of the flora or the microbiome or the bacteria, the uric acid in the intestine eventually produces oxalate and glycine, which provide carbon and nitrogen to the body. Lactic acid bacteria isolated from sauerkraut exert the ability to degrade inosine and guanosine, the two key intermediates of purine metabolism. Did you guys just hear that? That they actually said that sauerkraut actually help to degrade those specific intermediates of uric acid. Sauerkraut. If you've ever heard Dr. Patrick talk about sauerkraut, well, this is one of the things. Because a lot of times we're saying, hey, rather than take this, are you willing to actually eat liver? Are you willing to actually have apple cider vinegar? Are you willing to actually eat sauerkraut? Most of the time people say no, and we say, perfect, we have a supplement for it. So they actually are talking about fermented foods. Now, metabolites of the intestinal flora promote the excretion of uric acid. So the intestinal flora can produce some small molecular metabolites that affect host metabolism, such as short-chain fatty acids. So further studies showed that butyrate may promote intestinal uric acid excretion. So what are short-chain fatty acids? These are metabolites of the microbiome. So they need things in order to live, the microbiome. This is why resistant starches are important, because that provides, and a resistant starch is something that is resistant to digestion. You cannot break it down, but as it makes its way down into the colon, that undigested starch provides the food for the microbiome. Guys, look it up on some of the best sources of resistant starches. And then they provide food for the microbiome, and then their metabolites are known as short-chain fatty acids, which can promote intestinal uric acid excretion. But not only that, those things are helping with blood sugar control too, which is one of the reasons why, if you are low in short-chain fatty acid production, can lead to problems with your blood sugar as well. So what did they say? Hey, this isn't just an easy thing, that you can actually help to fix these things if you can start to normalize what is happening within the gastrointestinal system. So their summary: currently, uric acid lowering drugs are mainly achieved through the kidneys, while the intestine is the second largest uric acid excretion organ. The decrease in intestinal uric acid excretion will increase the burden on the kidneys. Isn't that interesting? And so if you have a bad microbiome, all you're doing is putting more pressure and more stress of your kidneys to start to excrete it. But remember this: if you've gotten to the point where your microbiome is that bad, then chances are is that your kidneys aren't filtering very well either, and all you're doing is putting more and more stress on it. So remember, what is it? It's a liver issue, and it's an inability to excrete within the intestines that now puts more pressure on the kidneys. So think of this: fatty liver, having a lot of poor microbiome, and then having a lot of kidney inflammation as well. So their solution, though, of what they said is that there is a bright prospect for a drug and gut microbiota research targeting intestinal uric acid transporters to treat hyperuricemia and gout. So their answer is, wow, this is amazing. Now we can start to come up with brand new drugs. And that's why they do the research. And they figure out, well, here's the problem. How can we make this some kind of drug solution? Which is what they do with everything. How can we create a drug solution versus how can we teach our patients to take care of themselves? Because only providing a drug solution is like wearing a back brace, is like wearing a wrist brace, and like wearing orthotics when you're injured in order to further decondition the person. It's no different than just doing this, guys. So if you think I need to avoid certain foods, I need to take my uric acid reducing medication that's going to target my kidneys, you will still stay sick. The reason why you're sick is still there. But all they're doing is manipulating the body and hushing the signals that the body is saying something is not right. And it's no different than cutting out the tongue of a baby who's crying too much. They may not cry anymore, but you have not addressed the reason why the baby is crying. Does that make sense, guys? I hope it makes sense to you. And when you start looking at it from this way, you will say, man, we have really been led down a bad path. We have been promised a fix when all we were promised was a back brace. And while it made me feel better, it further allowed me to devolve when I wanted to choose instead to adapt, but no one led me down that path. So a different approach is this, guys, is that if you suffer with problems with gout, number one, test the liver, okay? Test the liver. So there's certain markers that you can look at that will show if you have a fatty liver. And if you have a fatty liver, you're much more likely in order to have gout. Number one, because of what you did to create the fatty liver, but then number two, the things that aren't going to allow those purines to be able to metabolize correctly. Number two, test the GI system. When you test the GI system and you do a stool test, you will see from the north end to the south end of the gastrointestinal system exactly what is wrong, including what does that microbiome look like? What are you high in? What are you low in? And then also, what is that short chain fatty acid production? And so if you see that, now you can start eating in a different way, and you can also supplement in a different way in order to help dig you out of a hole. And then number three, as always test your foods. Always test your foods for an inflammatory response, because the immune system should never be part of the digestive system process. So test your foods, test the GI system, and test the liver. And those are the three organs that you really need to be concerned about. And then also you may want to look and see what's happening with the kidneys as well. A great regular test is looking at your glomerular filtration rate and seeing how much blood is being pushed through the kidneys to filter the blood in order to excrete urine, okay? Now, I will tell you guys this. Is there a time and a place where a person should take a medication? And here's what doctors should be doing. Bill, I know that you actually have gout. I know that your lifestyle is really bad. I know that it's probably horrible. I'm actually not trained on how to fix your lifestyle other than to tell you how to eat right and start exercising. More than that, I can't really tell you anything because I have no training in it. My training is actually in giving people drugs. My training is to put out the fire. So I'm going to give you this medication for gout. However, I don't want you to be on this for the rest of your life. What I would rather have you do is find a great wellness way doctor who can turn your life around and who can actually not just put out fires, but who can actually start rebuilding your body so that you can get this gout taken care of and you can start addressing other issues as well. Because my job is just to put out the fire. And if any doctor is telling you that he can keep putting out the fire, then any doctor is doing a disservice. So Bill, what I want you to do is I'm going to give you this medication. I don't want you to be on it. And in fact, I'm going to trust that you're going to find a wellness way doctor. So I'm only going to give you this medication for about 6 weeks. After that, I'm not even going to let you be on it anymore because that just means that you're not interested in changing your life and you're really more interested in a doctor's excuse to continue living the same destructive lifestyle. Guys, that's what a prescription really is. It's a doctor's excuse for you to continue living the same destructive lifestyle. Now, some people just don't know, so I necessarily wouldn't call it a doctor's excuse, but once you know, and once you know that there's another way, once you know that there's a better way, continue living in this right here is only a doctor's excuse just so you can continue living the same destructive lifestyle. And guys, if that destructive lifestyle that you know leads to your death, all it really is a slow form of suicide while you have fun on the way, ultimately leading to massive amount of suffering and massive amount of pain in your family as they watch you suffer, and it also causes them to suffer and to grieve. So you guys, once you start looking at your body as not as your own and that you're not living for yourself, but you're living for your mission, you're living for your purpose, you're living for your family, maybe that will start to change the decisions that you make and you will stop living the same destructive lifestyle. At some point, you really do, people do need to grow up and mature and to realize I need to be there for other people. This right here, this doctor's excuse to continue living the same destructive lifestyle, I could understand if you don't know, but now that you do know, now the only reason why you don't want to get better or you don't get better is because you really just don't want to put in the work. So guys, hopefully that makes some sense when it comes to gout. Again, liver, GI system, you also need to be testing your foods, probably get some kidney markers as well. But the GI, when it's healthy, will help take some of the stress and the burden of actually having to excrete that uric acid, because if the GI system is healthy, it can actually do a large part of it, okay? So guys, coming up, if you're from the Chicagoland area, our next talk that's going to be in person is going to be October 18th, 6:15 p.m. right here at Exemplify Health Center. So many people say, I want to see Dr. Thompson, I want to see Dr. Brian Coker as well, who's been doing a fantastic job in the office. Where do I start? Start with the inflammation talk, guys. And the reason why I just want you to be there is just because if you start understanding this, it makes it so easy why I say I want you to check this, and this, and also helps you to understand really what the first step is in order to help you get better. Remember, doctor means teacher, and if we're not teaching you how to take care of yourself, then the only thing we're doing is giving you temporary freedom from a condition in which you should have freedom for the rest of your life. That's what we really want for you. And then as well, guys, is if you haven't, go up to the top of the page or click the link on the description of this post, of this video, of this live video, and register for Make Immune System Strong. This is a webinar, Saturday, October 21st or 22nd, I believe. It's on a Saturday, 10 o'clock to 12 o'clock Central Standard Time. And when you register for that, The ticket for that is $20 to attend the event. We will email you a link 1 hour before so that you can directly join the webinar room. Guys, please get registered for that. So many people have asked, and so now we are going to be doing it, but we need at least a minimum of about 25 people to register for that event in order to make it worth my staff's time, our time as well. We would love to help you with this, as well, but I'm also going to be missing a soccer game if I do it, so it has to be worth it as well. So guys, be well. I hope you be blessed. I hope you guys enjoy the rest of your week. Again, please share this video with someone that you know who has gout, or someone who you know that wants to be at this webinar, so that they can get the link and that this will change the way that they think about the immune system for the rest of their life. So guys, be well, be blessed, remember who you are, and we will talk to you very soon.